Bladder cancer is the fourth most common cancer in men and the eighth most common cancer in women. And about 80% of bladder cancers are earlier stage cancers that can be managed more conservatively by preserving the bladder. About 20% of bladder cancers present with invasion into the deeper layers of the bladder, and unfortunately those cancers are treated with removal of the bladder. When we do need to remove the bladder, there are three types of reconstructive options that are available. The first option is called an illeal conduit, which is an external bag that collects the urine. The second option is an internal pouch in which the patient inserts a catheter in order to empty out the urine from the pouch. The third option is a neobladder, in which we create a new bladder out of intestine and the patient is able to urinate normally. Mrs. Steevensz was diagnosed with bladder cancer actually at a relatively early stage. It was non-muscle invasive, but she also had severe pelvic pain that had been long-standing.
I had interstitial cystitis, which is known as the third most painful disease known to man. It's where the bladder lining disintegrates, basically. And so everything that you eat and drink is extremely painful. And that started probably, 15 years ago. Then about 5 years ago, I went to my regular internist and he said, "Oh my gosh, I'm afraid you have bladder cancer."
She was tried on multiple conservative therapies for her bladder cancer, but continued to have severe symptoms that affected her quality of life.
So I said, let's just take my bladder out. I have cancer, I have IC. And he said, it's a huge surgery.
She had been suffering with such severe pain from urination that we discussed the option of a radical cystectomy, a removal of the bladder.
And I chose the illeal conduit, which is an external pouch. I absolutely love it. It's clean, it doesn't smell, it's easy. I'm more active than before. I never have to get up in the night because I have a night bag. It's fantastic. It's great.
Here at Loyola, we are experts in all of the various forms of reconstruction after bladder removal. We have a thorough discussion with the patient in order to figure out what is best for that particular individual.
And I know there are many probably skilled doctors at radical cystectomies in a city like Chicago, but that wasn't enough for me. I wanted him to feel almost like family. And I feel that way about all the people at Loyola. And Dr. Quek is brilliant and amazing.